It's great to be here. What we're going to look at today are some different treatment options for respiratory conditions, including COPD, sarcoidosis, emphysema. We'll hit on the respiratory conditions that are probably most common. And Danny has been so kind, she's actually going to control the slides for me as we go along. And then you guys are welcome to, if we have any questions at the end of the presentation, I would love to field questions and help answer anything that I can. So let's get started. And I know Danny wanted to know, we were going to ask where everybody is joining us from as well. We're always curious about that. So as we go along, maybe people could put that in on the side. So we've got the first slide. If you will go to the next one, Danny. I'm going to tell everybody a little bit about what we do here at Wei Laboratories. So we are committed to finding an integrated medical approach for our patients. We focus on helping healthcare practitioners provide those holistic care treatments to their patients. And we also believe that the patient benefit is the only measurement of the quality of the patient care. If our patients are getting well, then the care is where it needs to be at. And we do this by partnering with different healthcare practitioners, and we're looking to use our innovative natural products, protocols, and services to help improve their patients' health. Let's move on to the next slide, please. So the company Wei Laboratories was actually founded by Dr. Wei and his wife, Dr. Li. You guys can see them there on the left. They are both PhD biochemists. They went to the University of Minnesota during their PhD program. And in addition, they both conducted their postdoctoral training at Harvard Medical School. So they are the perfect marriage, we like to think, of traditional Chinese medicine and Western biochemistry. And the products reflect that. They were early participants in alternative medicine research, and what they do is they actually guide the products here at Wei Laboratories through rigorous clinical research to use that research to make it available to the general public through our product development. And that's what we're going to talk about today, some of our products that we have that are available as probably a last resort option for many patients that unfortunately have no other options at this time. So if we go to the next slide. So conventional therapy, these are the patients that we're looking at that usually end up coming to us. They're at that first evaluation, diagnosis stage, or they could be as far along as an end stage. And options that are usually provided are very slim. Most patients are put on prescription medications. Steroids are very common, prednisone, albuterol, different inhalers. In addition, most patients are placed on oxygen or some sort of mist generator. Doctors might suggest an exercise routine. In addition, the last resort kind of for these patients as far as treatment is to undergo surgery, unfortunately, and try to remove that damaged lung tissue. And then the final thing might be a lung transplant, which is kind of a very, very grim option for a lot of those patients. Can we go to the next slide, please, Danny? And here at Wei, we're looking at all the options that we can provide to our patients before using surgery or something like that as a last resort. I mean, for me personally, I would never want to undergo any sort of lung transplant, lung surgery, anything like that. And we have 3 core products that are at the core of all of our lung treatments. That's the Soup A, Soup B, and the LC balancer. And they actually come just like you see on the right there. It's a glass jar, and the products are made from all natural ingredients that are sourced from wholesalers in California. They are manufactured here in Santa Clara. Our headquarters is here in San Jose. Santa Clara is just a few miles. And we have, what we're doing with these products are we're using the body's own abilities to heal tissue, which is unlike modern-day pharmaceuticals, Western medicine, where we're using some sort of chemical or something to interrupt a process. What these do is they actually work with your body. So your body and your own immune system are rebuilding that new tissue and breaking down the scar tissue in the lungs. Next slide. So I'm going to tell you guys a little bit about the Soup A, the Soup B, and finally the LC Balancer product. What the Soup A does is that's where we're actually going to repair the damaged tissue inside the lung and help restore structure. We do this by enhancing the supply of amino acids, carbohydrates, and other cofactors that are necessary for lung repair. So we're helping the body to get the right nutrients to do what it already should have done in the first place. And that process will end up reversing lung degeneration. The Soup B product actually removes the scar tissue that's formed in the lungs. So we're looking at the nodules, the stasis in the lungs. We also use this product for thyroid nodules in the thyroid gland. And it's able to dissolve the scar tissue and the fibrous tissue in the lungs that has formed during, especially with our sarcoidosis patients, where we see that. Finally, the third product, the LC Balancer. This is one of our signature products here at Wei Laboratories. We use it with a variety of treatments. It's a great, great product, especially for aging populations. The LC Balancer enhances the microcirculation by improving the tiny little microcapillaries that line your blood vessels. A lot of times what we see in patients that have lung disease, they also have a lot of pre-existing conditions that have prevented blood supply from getting to the lungs as it could. In addition, this creates inflammation in the bronchial tubes in the lungs. With the LC Balancer product, we're actually able to reduce that inflammation and support the body's processes to release that mucus and clear out the lungs. The LC Balancer also supports the detox process that happens as we're dissolving scar tissue in the lungs to ensure that the body is able to get rid of those wastes and those toxins and heal. Next slide, please, Danny. So the most commonly treated respiratory conditions that we see here at Wei Laboratories and probably throughout the West are COPD, emphysema, IPF, idiopathic pulmonary fibrosis, lung mycobacteria infection, bronchitis, bronchiectasis, and finally sarcoidosis. So we're going to go through each of these and kind of dive in deeper about what products might be necessary and how we can treat these conditions. So starting with kind of our common core, the COPD, emphysema, bronchitis, all of these are where we've seen some sort of inflammation in these lung sacs, in the bronchial sacs, and in those tiny tubes within the lungs. We see it usually starts with an infection and then moves on from there. So a lot of these patients will see cases of pneumonia just reoccurring over and over and over. And we're looking at treatment for these patients without oxygen. So these are patients where it's mild, moderate COPD, emphysema, bronchitis, recently been diagnosed. Usually they're in pretty good health as well, not oxygen dependent is kind of how we evaluate. And these patients are going to require 2 to 8 weeks of treatment with the Soup A, the Soup B, and the LC Balancer product. If a patient is on oxygen, we're at that late stage COPD, very, very, very little oxygen being inhaled by the lungs on their own. We're looking at 3 to 6 months of treatment.
Hey, Rachel?
Yes.
If you don't mind if I interrupt for just a second. Christy used your treatment successfully, correctly? Is that correct?
Yes, that is, yes.
Okay, and that's why you ended up here tonight, by the way.
Yes, it is. That's actually how we've been connected as well. In all of our products, we have to have we'd like to include a healthcare practitioner in between. So Christy is actually our consultant for Wei Laboratories for our lung products. She works with patients that we see in the South Carolina area, and then as well as the rest of the United States. And she's actually our expert on the Soup products because she was a first end user. I mean, she's used the Soup products to heal herself. I think that's pretty amazing.
Yeah, really successfully. Yes. Share your story, Christy, because I think
that would be great, Christy. Thank you.
Yeah,
thanks,
I forgot to mention that earlier. Yeah, when I started looking up research because again the internet was my best friend when I was diagnosed with sarcoid. And I found Wei Laboratories, and I started on the products, and I think I started noticing a difference within the first week. Mm-hmm. So, yeah, I continue with that, and I told my husband that I felt like I had my life back for a while. So, yeah, I was very happy.
Yes, absolutely. Yeah. Well, and that makes all the difference when we have results. You know, then we want to know more. I know when Jack was helped with some nutritional supplements he was taking, I was all about it. It was like I was researching everything I could on every ingredient that was in it and trying to figure out why is this helping him when we've tried so many other things that just didn't do any good. And I'm sure you probably did the same with the Wei Labs products, the Soup A and Soup B and whatever you were using.
Oh yeah.
Yeah. Awesome. So sorry to interrupt. I just felt like that was really important, to have the connection. that we have somebody with sarcoidosis on the line here who has been in remission for how long now, Christy?
I don't even remember.
That long. Okay.
Yeah, I think it's been several years, because I think that was back in, when you first bought products, was several years ago.
Yeah. I mean, I've had a little bit of relapses here and there, but right now my lungs are clear.
That's
That's
great.
awesome.
Yeah.
And I do apologize, guys. There is a little bit of feedback. I think there might be a few people in the office there where Rachel is, and we're hearing a little bit of that conversation. So bear with us. Turn your volume up as loud as you can on your computer, and we'll do our best to get through it. So, okay, continue. I apologize for interrupting.
Yeah, sorry about the background, you guys. I can address that for just a moment if you guys want.
If you could, that would be great, because it is difficult to hear.
Just a second. Let me see if I can. Is there a way I can mute?
Yeah, if you just click on your video right there, you should be able to mute yourself right there. Awesome. Yeah, that'll help a lot, because I was even thinking, is there a TV on somewhere? Yes.
It wasn't mine, I promise.
Yeah. Mine either. We will take care of that right now. Thank you guys for being patient with that as well, and also letting us know that it's somewhat of an annoyance. We don't want anybody annoyed. We want everybody paying attention and learning and hearing all of the important stuff.
All right, guys, we're working on getting that down. Dr. Wei is actually on the phone in the background with I think a different doctor, because he's speaking in Chinese, so I'm assuming it's not with somebody that I know. But I'm going to ask him. I have a colleague going to ask him if he can quiet down just a little bit for us.
Oh. All right.
But yeah, and maybe he will come say hi. I'm going to see if we can work that in too. Sorry about the background noise, Michelle and Janet. We're going to work on that for you guys.
Okay.
Alrighty, so let's keep going. We can head on to the next slide, I think. So sarcoidosis, I'm sure everybody that's here is probably very, very well versed in the background of sarcoidosis, or you wouldn't be participating in this webinar. We're obviously looking at sarcoidosis is when we develop an immune response, and the immune system is actually what is causing the body to segregate any sort of infection or anything like that into these clumps, these granulomas. And that's where we see, your own body is attacking itself. So our goal with other products is to support your immune system in doing what it should be doing, as opposed to forming these granulomas in this scar tissue in the lungs. We'll support the immune system removing that scar tissue. Patients usually notice significant improvement 2 to 4 weeks for our sarcoidosis patients. I can honestly tell you from personal experience too, working with patients, as early as 2 to 3 days, patients will notice significant benefits. These are treatments that are going to last 1 to 3 months for mild, moderate conditions, and 3 to 6 months for our severe conditions. So quite a little bit of a treatment, but at the same time, if you're looking at a lung transplant, if you're looking at quality of life, this is not a long time. And we see patients that just continue to heal during this time and are fully committed to the program. And those are the people that we want to work with.
So Rachel, is this...
Yeah.
Sorry, I'm just going to keep interrupting, because I keep coming up with all these questions, and I apologize, but because I'm learning too, guys. So everybody on the line here, this is my first introduction. Christy's told me all about Wei Labs because she had such phenomenal results, and so of course, my husband had sarcoidosis, she had sarcoidosis, and we want to help everybody be more aware of options. But is this something where can people who have sarcoidosis who are being treated with prednisone, which is very common, or methotrexate, or Plaquenil, those things, can they do this treatment in conjunction, or is this something where you just treat when they're not on any medications?
No, great question, Danny. So a lot of our patients maintain their same medications. They're very scared to go off medications, which I completely understand. And what we do is we actually, as the products work, we see their doctors and reducing their medications. So a lot of our patients that are on steroids full time actually end up reducing their. I'm so sorry about the phones right now. I thought everybody would be out of here by now, but some people are still working late. But anyways, a lot of people we actually see reductions in the medications that they're on, and we see their steroid use reducing. So we've had patients, I'm going to show you guys a case study at the end where she was taking 25 milligrams of prednisone a day and was moved down to 5 milligrams, and that was just after 1 month of treatment.
Wow.
And the effects on that too, I mean, immediate weight loss as you remove steroids from the body. Usually with our patients, that's one of the biggest things that we see is that weight gain, because the steroids cause your body to hold on to excess weight. So that's really just a huge benefit in itself, being able to decrease their oxygen use, decrease those, pharmaceutical medications that they're on, including the steroids.
Awesome. Thank you.
Yeah.
So next slide.
All right, so we've got, this is the idiopathic pulmonary fibrosis, very similar to sarcoidosis. We're seeing, again, the lungs isolating that tissue and forming the scarring in the lungs. The early stage, we're looking at 1 to 3 months of treatment. Late stage, 4 to 6 months. We have patients that come to us that are at end stage, 24/7 oxygen use, 8 to 9 months we're looking at for treatment for those patients. But we're able to see really great results at the end of that time period. We have a lot of patients that even just small reductions in their oxygen make a huge difference. I have a patient that was actually homebound because he was on oxygen 24/7, and he's been able to reduce his oxygen dependence and move out of the home at least for a couple hours a day now with the soup products.
That's awesome.
Yeah, super great. And this is how we measure results. I included this because I think that that's important. It's important to me as far as caring for our patients and being on the kind of the consulting side where we have our other doctors and practitioners observing the patients every day. This is a way for patients to track their progress while working with their practitioner, like Christy. And this is where Christy would talk with the patient. We'd find out before treatment, before they even start, how are you doing as far as shortness of breath, coughing, chest tightness? What's your energy level like? Those are the kinds of things that we're looking for. And then we take follow-up on those every 2 weeks, every month, even every week, as soon as every week. What we're looking for is improvement, and if the patient is improving even a small amount, that's excellent, and that's what we're looking for. If there's a reason the patient isn't improving, we're usually able to pinpoint what that reason is and treat that underlying cause that's going on there. All right, next slide, please.
Wish every doctor's office did that.
Yes, I agree. I can't tell you. And again, this is kind of what I just mentioned, but oxygen saturation time, oxygen volume, usage during the day, that's really important data for us. A lot of our patients can rattle off those numbers at the drop of a hat. These are numbers that are basically deciding their quality of life right now. How attached do they need to be to a breathing machine when they're with their family or when they're trying to exercise or do things like that. So there's a lot of freedom that comes with reducing that extra oxygen that they need during the day. And then we always like to ask, too, if patients are able to get a chest x-ray before treatment and then after treatment. We see great results that confirm improvement from the products. So chest x-rays are awesome. Lung function tests. It's awesome if we can line up treatment right around that time. So usually patients will have those done maybe twice a year or every 3 months. If we can coordinate treatment with begin and end, that's awesome for us. And for the patient, we want them to be able to see the results too. So that's really motivating. Next slide. Awesome. So these are some of the results that we've had from our patients. Improved shortness of breath, decrease of that really strong wheezing cough, increase in the productive cough, which is actually good. The productive cough helps the patient to actually cough up that scarring that's in the lungs, that scar tissue, a lot of that mucus, that inflammation. Often we see patients that have dried blood that's been sitting in the lungs for a long period of time. And then in addition, the increase in energy levels, reduction of oxygen dependence, reversing lung degeneration that's confirmed by an x-ray in 3 months. And to the right, you'll actually see a really cool picture. We had a 57-year-old male patient, and he was diagnosed with severe COPD when he came to us. He sent us this picture, and this is after he was on a 6-month treatment protocol. He was able to climb actually 21,000 feet on a recent expedition to Aconcagua, I think I'm saying that right, but I do know that it's the highest mountain in the world outside of Central Asia. So it says there.
Wow.
And he said it was pretty cute, not bad for an old guy with a clogged lung. And he was an absolute pleasure to work with. He's such a fun guy. So that's Rick, and he works with one of our doctors out in Texas.
That's awesome.
But he was determined to get better. I mean, from day one, and the products really helped him to do that. And I think, you know, there's so much that goes into it too. It's not just the products; it's happiness, motivation, the people that you have, your support system, attitude too. Yeah, exactly. You got it.
Absolutely. Yeah, that's awesome.
And then I decided to include this too because this is actually somebody that Christy worked with. This was one of our patients, Lydia Parker. She's still on the soups. I asked her if I could share this information with you guys, and she said, of course. She is the nicest, sweetest person. But she is a 73-year-old female, so she was diagnosed with idiopathic pulmonary fibrosis. She's a mild condition, but she also has some underlying pulmonary hypertension, heart disease. She had a bypass a couple of years ago. And her biggest symptoms, her biggest complaints were she was so tired, her energy level. She struggled to do just everyday things. Chronic bronchitis in addition, so she kept getting sick over and over and over again. If we can go to the next slide, her story continues. So she made this. Lydia made this progress report, which was absolutely beautiful, and I now use it with other patients because I think it's so great.
Yeah, she's
and my
amazing.
colleagues all love it. Yeah, she's so cool. And she loves Christy, so I think they were a perfect fit. But you can see, if you look, you know, from left to right, even if you just look at the bottom, that today I feel. So that was when she started the products, that Saturday, June 4th, and that was the sad face, bad, didn't feel good. Again, the fatigue, the low energy. And then as things went along, you know, we saw by Tuesday she was feeling good. And I spoke to her on the phone on Friday, and she said very good. Her energy levels were back up, and this is just 1 week, just 7 days of being on, you know, products. And this is all while she was still on her. You can see at the bottom she was on a nebulizer, she was on prednisone, and I think that's a high blood pressure pill, that third one. But in addition, I mean, just the quality of life, again, being able to have physical energy back and not feel exhausted every single day, huge for her.
Yeah, and how long has she been on your treatment thus far?
Yeah, so she is now in her 3rd month. She's just about to start the 3rd month.
Awesome.
And then I've got a little, I think there's another update. Yep. So this is just what's going on now, actually. Yeah. So July 8th, her pulmonologist conducted a lung function test, and the results of that were that she'd significantly improved from that. So he was able to reduce her prednisone down from 20 milligrams to 5 milligrams, and she's on a declining schedule for that now. That's actually been completed now. But now she's down to 5 milligrams a day, and her pulmonologist cannot believe this. I mean, he's asked her, what are you doing? What's going on? And she's really nervous to share the information with him because she thinks that he'll tell her she shouldn't be doing this.
Right.
And so we were able to give her some literature to share with him. And now he's actually contacted us because he wants to see some of the clinical trials and things like that. So making a believer, I think, is important. And usually that's what it takes. It takes someone seeing someone else go through this treatment to start to believe that there really are possibilities out there.
Yeah, my doctor proclaimed me a miracle.
Excellent. All right, we can go on to the next slide. And this is another case study. This is with one of our acupuncturists, Dr. Bertosini. Dr. Laura had a 65-year-old male patient, came to her, had a chronic lung condition that was related to idiopathic pulmonary fibrosis. In addition, he had some pretty severe kidney problems. She put him on a treatment that consisted of herbal therapy in conjunction with the acupuncture treatment. We'd love to see our products used along with chiropractic adjustments, acupuncture, anything that the patient is interested in from a natural, holistic wellness side, we fully support. The patient did the Soup A, Soup B, and LC balancer. We also have a product called Clear Lung that is a lung infection product that this patient used. It's been 4 months, and he's super happy with the results. His doctors gave him 2 years to live, and now we're just continuing to see improvement every single day. And today, now, I think we're into, I think this has been about 9 months for him. He's still using inhalers, but he no longer needs his oxygen machine every single day or the nebulizer. So it's really amazing. He was a great, great case.
And so he's been on treatment for 9 months?
Yes, yep, and he's still continuing. He was a very, very severe condition. In addition, we had the complication of the kidney problem, so that took a little bit longer there.
Mm-hmm. And so I was going to ask you earlier, if somebody, you know, for example, this gentleman, you have maybe on a 6-month program initially, or a 9-month or a 12-month.
Sure.
At what point do you decide you're good and you no longer need Soup A, Soup B, lung balancer, clear lung? Where do you?
That's a great question, Danny. Once we see the improvement, I mean, once the patient is satisfied with the improvement level, then we will stop the products. And for some people, that just means getting off oxygen. We have patients where their entire goal, no matter what, is to just get off of oxygen. So that's really where we see the greatest benefit too, just in, again, quality of life. But it really depends on the patient's goal, and then we always want to look at underlying causes or underlying issues. Everyone will not get back to 100% improvement. We have to manage expectations too. But for a lot of people, any improvement, 25% to 50%, is a huge benefit.
Yeah, absolutely. And this, I'm sure, obviously, is something that we all promote and advocate, is options. This is something, again, another thing I wish our Western medicine philosophy would be gear more towards is this is not a life dependency on prednisone. But unfortunately, many, like for my husband, he had to demand to get off the stuff after 3 consecutive years of prednisone use. And so I love seeing a doctor that first measures where you're at, takes a good guideline measurement, and asks all these wonderful questions about how do you feel and your energy and all those things, and then continues to measure the progress throughout. And in turn, these people can be still on Western medicine and get off of them eventually, maybe, right?
Right. Yes, completely. And that's our goal. And that's a lot of patients' goals, too. I mean, the steroids, just the toll that they take on your body and your immune system, that's part of why people get the reoccurring bronchitis, the reoccurring pneumonia. We're suppressing the immune system. So in traditional Chinese medicine, we believe, and here at Wei Laboratories, we believe that the body is capable of healing itself. We're healing from within, as opposed to using these outside pharmaceuticals to kind of interrupt those processes. We're using all natural herbs that grow on the earth that you could go out and find, and combining them in a way that meets the biochemistry of the body. So that's what's so amazing.
Yeah, that's excellent.
So let's go on to the next slide. I think we've got another. So we're going to talk about too, and I think that this is important to bring up, patients with late-stage conditions. So when we're seeing that late COPD, emphysema, IPF, there's usually 1 or more additional complications that have gone on, and sometimes we have additional treatment that might be required to improve their lung conditions. So we're going to talk about just a couple examples of those, but I want to highlight that that's something that we look at. We don't just look at the lungs, we look at everything. Lung inflammation, if the patient has colored phlegm, we're looking for that yellow-green phlegm. Frequent colds, flu, pneumonia. We have a product called Clear Lung that actually clears up lung infection. And that product will go in, and patients see in 1 to 3 days they're done coughing up the yellow-green mucus. They're able to breathe deeper. Usually we see pretty instant results from that product. And that's something where you're not going to continue that for 6 months. Clear Lung is a 1-week, maybe a 2-week treatment, and it's just a capsule a few times a day that the patient will take, but it's not a long-term product. This is a short-term, trying to get in there and fix the infection and support the immune system and then get out. And then the second complication here on this slide we see is extremity edema and congestive heart failure. This is very common, especially with our COPD patients. Lydia actually experienced this as well. Patients often get on things, diuretics, Lasix is a really common one. They have that ankle swelling that's so uncomfortable. And in addition, that complicates the heart working so hard to compensate for the poor lung condition. So we're trying to pump that blood, and we have all that extra fluid in there. We have a product called Java that actually improves the lymphatic circulation and reduces the pressure that's on the heart. Java is another product that's going to work really quickly. We'll see within a week, patients are able to start seeing that fluid go down, that retention go down. This is a product we probably would not have a patient be on for more than 1 week to a month, but another really, really good one. Move on to the next slide. And then, in addition, I always bring this up, and this is something that I've actually dealt with myself. So GI conditions, we're looking at poor digestion, gluten intolerance, food allergies, acid reflux, huge, huge one for our lung patients. Research has shown that actually the majority, 80% of IPF patients have acid reflux, and that acid actually leaks out of the esophagus into the lungs, causing some of that irritation and damage to the throat, the bronchi, and the lung tissue. Poor digestion can also result in our products not being absorbed. So if there is any sort of GI condition the patient's on, usually what we'll see is patients tell us they can't go a day without Prilosec. That's our most common kind of phrase. And we're able to put them on 2 to 3 weeks of our GI protocol, and that's Spring Juice, Spring Capsule, Pearl, and Formula B. And then they're able to see the healing from the GI products in addition to starting the lung treatment around that same time. This is a really, really great protocol. It's actually improved. I used to have a lot of different food allergies, and the GI protocol really helped heal kind of what was going on there in my poor digestion. Many, many people in the West have the low stomach acid, and we see that a lot, and that's where you're not able to digest food fully and really sanitize the food that's going into your bodies, and that's where we get these gluten allergies and food allergies, things like leaky gut, all trace back to the poor digestion that's going on in the body.
Well, and Rachel, so I'm just curious, is this something,
Sure.
do you guys, because I don't know a lot about your services, obviously, so you treat people who come in with all different kinds of conditions, or do you just only focus on lung conditions?
So we actually treat the entire body. We treat all conditions. Dr. Wei and Dr. Lee actually conduct a lot of that research on pretty much everything. They're able to address anything and everything that's going on with patients that we see coming in.
Awesome. Okay. My son needs this right here. I'm just looking at this going, okay, I'm going to be calling you.
Everyone, you know, in the West we believe could really benefit from the GI protocol.
And is that something you recommend? Is this like a once in a lifetime, or is this once a year, or does it depend on the patient as well?
Yeah, that's a great question, Danny. It depends on the patient, definitely, but all of our products are not meant to be used for life. They're meant to go in and help your body to heal, to nurture, support, and rebuild whatever the problem is, whatever the immune system has missed. And so we're doing that by actually nourishing the organs, which is really unique. A lot of medicine doesn't do that. It just treats symptoms. Right. We're actually nourishing the organ and treating the organ. So then that organ is healed and it's able to function properly. So this is really a once-in-a-lifetime treatment. This is 2 to 3 weeks of these products, and you're able to see the improvement.
That's amazing.
And sustain those results, too.
Awesome.
So we can move on to the next slide, I think. Awesome. So this is Dr. Lee's newest research, which is actually pretty amazing, is on Mycobacterium. She traces pretty much all aging and cancer, infection in the body back to Mycobacterium. And what Mycobacterium is it's a really tiny bacteria that actually rides in to your body with other infections. The majority of IPF patients have had a severe pneumonia at some point, and they tell us, we hear this all the time, I got really sick and I never fully got better. I never got back to 100% after I had that pneumonia in 2013. And that's where we believe that the Mycobacterium infection happened. It's Mycoplasma pneumonia bacteria, specifically in the lungs. So the symptoms of this are always going to be that chronic immune system overreaction, because your immune system is reacting to this mycobacteria. So we see chronic allergies, nasal congestion, excessive mucus production, postnasal drip, and for this we have 4 products that we use together, and this is only a 2-week treatment. So with the soup products, we put the patients on these for about 2 weeks. Again, 1 to 3 days, amazing results. Patients, we usually know if we've hit it on the head with the myco, because they'll say, oh my gosh, this is the first time I haven't had my sinuses completely congested. I'm able to breathe again. So that's the Clear Lung, the New Base, Java, and Jade. Those are our 4 myco products. and those help to, the clear lung is actually going to reduce the inflammation in the respiratory tract, especially the nasal cavity where we see the sinus pressure. And new base helps to suppress the immune system, so it calms down the immune system. And then we have Java, and that's going to improve lymphatic circulation and just help the body get rid of that excessive waste. And then finally, Jade actually enhances the natural immunity in the body to help get rid of the Mycobacterium infection. So all of these are just supporting our organs and what they're doing already. They're supporting what the immune system should be doing. And I always like to highlight that, you know, we're not masking symptoms. We're not giving patients a decongestant or something like that. We're giving them something that's actually going to heal from within.
Which is the key, right? So right. I have a question for our viewers and our listeners, because I'm super curious. If you guys would, if you don't mind sharing, if you know, it's totally up to you, volunteer. Have you had chronic bronchitis? Have you struggled with chronic pneumonia? I'll share with you girls and everybody here. My husband had pneumonia when he was 6 months old and almost died from it. And from that, every single year, it was like fall would hit and he'd have bronchitis. Yep. Every single year, to the point where, you know, they poked and prodded and scanned and everything because they couldn't figure out what was going on with his lymph nodes. It ended up being sarcoidosis, but they said, let's remove your tonsils. You got this chronic bronchitis. Your tonsils are shot. And when they did that, they removed a lymph node and finally diagnosed him with sarcoidosis. But so I'm hearing this and I'm like, I want to know, what is there just like, because sarcoidosis is such a misnomer. Like there just seems to be such mystery around it that I hear these things and I go, shoot, I wish I would have known all of this before, right? Just that's why I wrote my book, so you have information. So if anybody wants to share, yes, I've had bronchitis or pneumonia or anything that Rachel is sharing that just is really hitting home, we'd love to hear.
Yeah, and I think just to touch back, you know, we hear that all the time with our patients, that they got sick and they never got better. You know, they got back to 70%, but they were never back to that 100% that they know that they were. You know, they know what it feels like to feel good, and that's what I think is so, you know, it's just really like pulls at the heartstrings to hear when we talk to patients about that.
Well, and it's such a key. Oh, sorry.
No, go ahead.
I just wanted to say it's such a key. I mean, share with us what your thoughts are on this, but I think it's such a key to, if our body is at 70% for 40 years, eventually massive disease, you know, chronic disease is going to happen. We can only fight it off for so long. So, yeah.
Yep, you're exactly right. And I think people get used to feeling, you know, okay. Not feeling good, but just feeling okay. And then I think as time goes on, you know, we're able to see those patients and their energy levels come up, and they say, I haven't felt this good in years. So that's pretty amazing. And I'm seeing Janet's coming in over on the side. It looks like she was revealed asthma, COPD, emphysema, so there were a lot of underlying conditions before she even got that diagnosis. And then Michelle looks like chronic tonsillitis, which is usually an infection. Doctors give you antibiotics for that, and probably some steroids too.
Which doesn't do your GI tract and your, you know, your immune system any.
Yeah, that's true.
Yeah,
so this is a case we had. It was a 59-year-old male came to us, late stage idiopathic pulmonary fibrosis, was seeing small improvements from the SOOPs, the LC balancer, the lung protocol. I mean, it was enough that he would say, you know, I'm feeling better, I think I'm feeling something, not sure what's going on, and that's usually not the response we get. The response we get is like, wow, this is amazing. And he was complaining about this postnasal drip all the time. He was always bringing that up. And so finally, we are actually able to consult with Dr. Lee and Dr. Wei here. I mean, they sit in the office with us. They come around. We meet with them many, many times during the day. And Dr. Lee predicted that it was a lung mycobacteria that was causing the complications with the treatment. So we put him on just for 1 week, the Java, Clear Lung, Jade, and New Base. Immediately, like less than 3 days, he said, this is it. This is exactly what it is. And I feel a huge difference. And he maintained the soup products, kept taking those. The same results, you know, improved breathing, decreased cough, increased lung capacity. And he was able to reduce his oxygen by 30% after just 1 month of treatment. So that's amazing. And he's someone that was a late stage, you know, probably had been given 1 to 2 years to live at that point. Or he was going to live completely dependent on oxygen for the rest of his life. Yeah, pretty amazing. So the mycobacteria is always something we kind of keep in our, I guess we call it our back pocket. And then finally, how to order. So I know that a lot of people are going to be really interested after seeing this. People that have tried everything else, you know, we like to be that last resort. We are that last option for all of our patients. So we like to have a healthcare practitioner, has to be involved, and Christy actually can be that consultant for you. She does that through the Dr. Folk's office over in South Carolina, so she's able to consult with our patients. And the soups are very, very easy to use. I mean, you're just taking morning, night, and then one of the products you actually do take at lunch as well. But there's only 3 products, so there's not a lot of complication. There's not, you know, 100 things that a patient needs to worry about. It's very straightforward, very user-friendly. And then again, like we talked about earlier, the products work so well with these additional wellness treatments, chiropractic adjustments, acupuncture. Some patients are doing a juice cleanse, or they have different diets that they follow, you know, that help them feel good. We support all of that, and really whatever fits the patient works well for us. And then in addition, we have a custom patient profile form. So patients are able to fill this form out, and then in 1 to 2 weeks, Dr. Wei and Dr. Lee can provide recommendations for this patient. And this is for our patients that have, probably we're looking at 3 or 4 chronic conditions. So we have a lot of underlying things going on to address, and Dr. Lee and Dr. Wei can actually provide kind of a timeline for patients, which is so, so helpful.
Mm-hmm.
I think that's it for that slide. We can move on to the last one, which is our information. So this is our address. We are located in San Jose, California. Again, all of our products are manufactured here in California and grown in California. A lot of traditional Chinese herbs that you'll find are not, they're not coming from wholesalers in California. They're coming from China. And it's very, very hard to regulate those herbs. So all of our products are from wholesalers here in California and then manufactured in Santa Clara. And that's our phone number there. The 1888 number, and then in addition I put our website, weilabs.com, and we have an additional website as well. I'll actually post it in the chat, maybe that'll be helpful to people. Institute. I'm going to post it in the chat, and then people can copy paste it if they want after the fact. But it's www.weiinstitute.org. And in England, so Michelle, we do ship internationally. We're able to do that, and we can get the products to you over in England. We ship all over the world, international shipping. And then again, Christy, it looks like she put her email on there too, so if anyone wants to contact her directly with questions, wellnesscounselsc@yahoo.com, I see there?
CSC.
CSC. Oh, I'm sorry, yep, CSC.
It's kind of long.
Perfect.
Yeah, so that's great. And Christy is a wealth of information on the products too. I think she's such a great resource. We're so happy to be working with her and Dr. Folk's office.
Thank you.
Yeah, absolutely. So that was a lot of awesome information, Rachel. I just have to tell you, thank you so much. I'm going to be listening to this webinar again, and I'm sure everybody who's here will be listening to it over and over. It will be posted on our survivingsarcoidosis.com website. It will be posted on our Sarcoidosis Reach for a Cure Facebook page. And everybody, even the people who weren't able to join us live, will get the recording as well as you guys. So just know that. And I'll also, if it's okay with you, Rachel, can I post this PowerPoint link so they can download it and like go back and look at it? Or
yeah, definitely. Okay. That would be wonderful.
I didn't know if that was public.
No, that's totally fine. There's a lot of great information on here too.
Yeah, I agree, and I think it's nice to have. Then they can see it. They can, if they have problems with their eyes and things like that. Some people, it's just easier if they can expand it on their own computer and really see what everything is saying.
Sure.
So guys, yeah, we're going to open this up to Q&A, but first, before we do that, I want to share something that, again, we forgot to say in the very beginning.
Oh, yes.
Have patience. This is all, we're not pro-webinar presenters, but
yes.
Rachel, do you want to do?
Yeah, definitely. So we're actually going to raffle off 2 weeks of Soup A, Soup B, and LC Balancer to one of the participants that has actually been part of this this webinar that stayed from beginning to end, and I think Danny has a list of email addresses, so she's going to reach out via email to one lucky person that has logged in, and then they are able to get 2 free weeks of products for them or a family member. I know a lot of people are here for family members as well. So we'll do that raffle, and then I think, Danny, do you want to, when will it be announced?
So yeah, so tomorrow, I know, right, Janet? Are you excited? Because yeah, and so there's, I will be downloading this webinar, and I have to edit it. It takes me a little time, but when I'm able to get that live on our Surviving Sarcoidosis and our fan page, our Facebook page, I will make that announcement. So it should be by tomorrow. I will also be sending an email, so try to reach people where they're at. Tomorrow by this time, by 6 p.m. Pacific.
Perfect.
Okay?
Great.
Yeah. Yeah.
Sounds good. I know Lynn had asked, I just want to address, so most insurance does not support these products and treatments. Depending on if your chiropractor is able to, to do a chiropractic adjustment or something like that, and insurance covers that. We see a lot of patients that are able to connect with a doctor that way, but no, insurance does not cover these treatments. So this is, unfortunately, an out-of-pocket expense.
Another
and
thing.
Janet, I'm seeing. Oh, go ahead. Sorry.
No, you go, Rachel. You're the. Yeah.
Nope, I was going to move on to something else. So Danny, you go.
Well, I was just going to say, I think that's something any of us who have sought out something alternative to Western medicine usually isn't covered on our insurance, and I know that was something that Jack and I went through, and it is extremely, I mean, even having insurance and going through Western medicine protocols is expensive, right? Even if they cover a lot of it, you still have deductibles and costs. So when we decided, are we going down the natural road, or are we going to continue down Western medicine that we've been doing for 5 years? Which one? Because we can't afford both. That was a difficult decision. It's really scary because we don't know what the outcome is going to be, but we did make that choice, and financially, it was just one of those things where we just had to find a way in hopes that it would help Jack, and he's been in remission for 7 years now. 7 years last May, 2 months ago.
Right.
So, yeah, and I love that the fact of this is something, again, some people might be on your treatments for a year, some might only need it for 3 months. So, weigh the cost with that. Could you give us an idea? I mean, I'm sure we can go on your website, but could you give us an idea of what it would cost to be on Soup A, Soup B, and Lung Balancer, since that seems to be the majority of everybody's using that?
Well, what we like to look at, too, is patients. Everyone comes to us, with a different budget, too. So we're able to, at full dose, we're looking at around $800 to $900 a month, and that depends on, the length of treatment as well. But we're able to, with some patients, actually do a half dose of product, and that helps with cost as well. So if the patient is able to respond to just a half dose, we can reduce the cost down to $400 a month or less, depending, after that. Or even we have patients that do a 1/3 dosage, so we're able to adjust dose of product, which helps the products to last longer for that patient. So if cost is an issue, please ask about microdosing and reduced dosage, because you'll still see great results. And then in addition, we're always willing to work with people. Our goal is to get you well. I mean, that's the goal at the end of the day, is to help people.
Yeah, absolutely. Okay, so now go back to what you were going to address. I think was a question or something Janet might have said.
Yeah, it looks like, so Janet said, 4 weeks ago, she's looking at allergies, stuffy nose, extreme fatigue, and she was in remission, but it looks like there might be a myco-infection, that's sitting there. That's usually what we see. We see the body kind of starting to heal, and then we dip down again into that allergy, stuffy nose, really tired, and we're not sure, what's going on there. So I always like to bring up myco. And myco is really interesting. I mean, Dr. Lee now is focusing all of her attention and research on Mycobacterium, And she, like I said before, believes that that is really why people age and why cancer is actually able to spread in the body, because the immune system gets distracted trying to fight off this mycobacterium. Yeah. Pretty interesting stuff. The research they're doing here is very, very cool. That's one of my favorite parts about being here, definitely, is getting to hear what they're researching or what clinical trials are going on right now.
Yeah, so can you share a little bit about that? Just, I mean, I don't want to take up too much of your time, I know everybody, but can we just take
not at all.
3 minutes to hear what they're researching?
Yeah, I mean, the Mycobacterium has been our biggest one. Outside of lung Mycobacterium, Dr. Lee is doing a lot of research on brain Mycobacterium. So we work with some different Alzheimer's and dementia patients that have, dementia, you have the scarring in the lungs that you're actually able to see, and a lot of that she believes comes from, her big theory is that that is from Mycobacterium that gets into the blood-brain barrier, and then the immune system reacts to it, and that's how we develop these scars on the brain. We have a full protocol for dementia as well as Alzheimer's. I'm working with one of our doctors is actually treating his mom right now. We're working on that patient right now, and she's been able to see great results, not so much in the memory, but just in energy levels. She's back to not spending the entire day in bed. She's pretty alert. He always says this, that her eyes are so much brighter. He can look at her, like the whites of her eyes now. And it's a long journey. I think that we're only in probably the 2nd month right now with treatment. But this is probably a long journey with a dementia patient. She's older, so I think that makes it harder too. But Mycobacterium is super interesting, and that's where Dr. Lee is really focusing on that now. And she loves talking about that too. Unfortunately, they had a prior obligation tonight, so they weren't able to be here. We're actually it's 6 p.m. We're on the West Coast, so.
Maybe we can get them again later. But
yeah, definitely.
So with the lungs, how long have they been studying and doing things that pertain to chronic lung diseases?
Oh yeah, sure. So we have actually been, the soup products have been around now for 15 years, and we have treated over 5,500 patients since then, as far as a clinical trial level, where we've actually looked at the results of those. So we've tracked those patients. Sometimes we have patients that will start a treatment and fall off, so they're hard to follow. But we've had many, many patients that we've actually followed from beginning to end, which is great.
Absolutely. Is that something that you could share with me that I could also post?
Yeah, definitely.
The results?
I can get you some more information about that. The weiinstitute.org website has a lot of cases, specifically kind of like the ones that I highlighted, some that I've personally been a part of, but there are cases on the Wei Institute there where we have basically doctors that have presented cases. And then we have another website too. I'll put this on here. It's famousdoctor.org. It's posted it up there, and that's actually where our doctors are able to publish their successful cases, and then they can essentially gain referrals from there. And so Dr. Folk's office is on there as well, and Christy is on there as a contact for his office.
Okay, cool. Great.
Yeah.
Okay, guys, so we have 4 more minutes. So I'm just going to open this up, if you don't mind, Rachel, for anybody to type in a question as quickly as they can, and feel free to share, or, like I said, just ask any question that you might have.
Okay. Yeah, Lynn, that's great. Really resonates, I'm sure, with everyone here. Everyone encourages, they can't believe that we're steering people away from the Western treatments. So yeah, thank you for being here. That's great. I think for a lot of our patients too, we end up kind of being an ally for them. The first thing we say when we talk to patients is, "How are you?" And I think a lot of doctors don't even say that.
Yeah, absolutely.
So, yeah, just being a friend.
Yeah, how much does that make a difference, right? You're not alone in this. We're not saying your symptoms aren't real.
Right.
Because I hear a lot of people they just feel like nobody believes me. I look like I'm not sick, and I know I did that to Jack. I mean, there was years, many a days where I was like, "You don't look like you're sick. Get up," right?
Right. Even the tired. I'm tired, and people can't understand that. So Janet, it looks like you're seeing a functional medical doctor person, major gut issues, how long to treat with your products before starting the lung ones. So Janet, you can actually start the GI protocol at the same time as the lung protocol. We would start the two products together, and they would actually start working very, very effectively together. The herbs work really, really well with each other, and there's no counter interactions because we're using everything that's really natural. So you could actually, we have most patients will start the GI protocol and do that for 2 weeks with the lung protocol at the same time, and usually see very good results after those 2 weeks. If you need to continue the gut protocol, we could continue it for the first month if you wanted to, but usually 2 to 3 weeks is enough for the GI to see some good results, and then use the lung products. Oh, wow, Janet, that's great to hear.
Yeah, we understand, Janet.
Yep, that's what we're here for, girl. That's why we do this.
Absolutely.
Everybody needs a little hope and guidance and some direction, and
Sure.
I'm just happy you made it to the webinar tonight, so that's awesome.
Okay, so my last lung function test had dropped, so after coming off steroids for 1 month, put back on. Yeah, and we see that too. We see patients that kind of go in like a wave pattern. They get better, they get worse, they get better, they get worse. And our goal, obviously, is to have you continuously improve and continuously get better. Michelle, lung mycobacteria could be something to look at too. There, or if you have that mycobacteria that's causing things to come back from remission.
Okay, 1 more minute. This has been so great. I just again want to thank you, Rachel, for taking the time. Thank of course, Christy, you're amazing. Rachel wouldn't be here if it weren't for Christy, so thank you for setting this up and being persistent. And we hope that maybe we will be able to have Dr. Lee and Dr. Wei on, and we could maybe delve into some specific stuff now that we've covered some really good basics from their labs and what they offer. So, well, good. I'm glad you got better for a while. Let's see if we can get you better forever.
Yeah, definitely.
Yeah, so is there any last things that either one of you want to say before we leave tonight?
I'm just thankful that Rachel agreed to do this, and thanks for working with me.
Oh, yeah, no, thank you, Christy. You're awesome. Yeah, just if anybody has questions or anything like that, I think we're getting towards the end here. We can definitely answer those. We can always answer your questions later on, too, if you guys want to email Christy or call our main line. We can always help connect everybody, too.
Yeah, and so we will announce tomorrow who the lucky winner is for the giveaway that Wei Labs has been so generous to offer. Thank you for doing that, too, because that is a big deal. Problem. I mean, just, Christy, how long did you take these before you noticed? You said like a day, I think, didn't you, or 2 days?
No, it was probably close to a week.
Okay.
But
still.
But yeah,
so
tremendous improvement.
Yeah, 2 weeks of treatment that they're offering, I believe. That's what it is, right, Rachel?
That's a huge deal.
Yeah, or if if a patient wants to put that towards 1 to 2 months or 3 months of treatment too, we would just take that off of
credit.
whatever they wanted to do as a credit or something like that. But yeah, 2 weeks is enough to see that big improvement and to really, we believe, get people on board. And
we want to hear the success story, okay? So whoever the lucky winner is, we want success stories on our next webinar.
Sounds good.
And I hate to have to ask, but I believe we have another webinar coming up with another doctor that Christy has awesomely, connected with in August.
Yes, we do. My naturopath in Seattle.
Awesome. So we're just going to keep the learning and education going so we can all continue to make better decisions for our own health and for those that we love, and hopefully prevent some symptoms and some diseases and some calamities that could happen in the future. So girls, I want to thank you so much for being here. We'll make the announcement, and this will be posted tomorrow on all of our Facebook pages and everywhere to make sure that everybody who couldn't make it live gets all of this wonderful information. Thanks so much.
Awesome. Thanks, guys. Have a good night.
Thank you,
everybody.
You as
well.
All right. Bye.
Bye.